Hey there. Welcome to This Week in Pharmacy for April 3rd, 2026. It's April already. Jesse, what the hell is going on?
How did that happen?
It's the second quarter of 2026.
That is amazing, isn't it? Time just continues to go faster and faster. And if anything, I think that's the invitation for us to, it's the invitation for us to keep up. Right, you've got to keep moving forward, because otherwise you're going to get passed by real quick.
So Jesse had a little confession, and he didn't say I wasn't allowed to say this to thousands and thousands of listeners, but Jesse said, "Hey, he and I just got back from Los Angeles, the APHA, American Pharmacists Association 2026, redefining possible," which is kind of a cool theme. I'm always a half glass full guy. And Jesse admitted that he's feeling like an old guy.
Yes. Todd, it's interesting. During my time with Rite Aid, we were at the annual APHA annual meeting every year. We were sort of part of the presentation of the recruiting team. To be able to talk about the different things that we were doing within clinical services back in the day. And it was real interesting just to see how that conference has changed and evolved, right, over the years. And so I believe I had to get a calendar out. I believe the last annual meeting I attended was back in 2016. And in 2016, I sort of felt like I was on the uphill climb, right? I felt like I was still one of the young guys. And then this year, 10 years later, showing up in Los Angeles, I didn't make it into town until Saturday night. And of course, there's receptions right away. So I did my best to get to some of those. And the first thing that stuck out to me on the escalators is, wow, there's a lot of young people here. And that's on one, I don't know that I was mentally prepared for that, but two, it is so exciting. It is so exciting to see young people involved and caring and active, and participating in that process, to be involved in the conferences here at the national level, and I'm sure at the state levels as well.
Yeah, embarrassing story too. I'm in the booth. I have two people waiting for me for interviews. I'm wrapping up with Walter Ansanye, who's known as the Fit Pharmacist. He's amazing, or your favorite fit pharmacist. And he's now he's doing his own brand deals. He's building, his own social media business, and he's even doing some consulting. I'm so excited for him. And as I turned, there were two pharmacy students. I know they were students because of their tags, thank goodness. Mm-hmm. And then the next person that said hello was also very young looking. And I just hurry up and said, "So what school do you go to?" And she's like, "Yeah, I've been practicing for like 3 years." And I'm just like, "Listen." And she laughed and she's like, "I get that all the time. Don't worry." And I'm like, goodness gracious. Like I do feel like an old guy now.
Mm-hmm. I was out there. I had two sessions to present at the annual meeting, one on Sunday and one on Monday. Both were looking at things through a generational lens. So Sunday I talked about generational leadership and how do you take people from 4 different generations in the workforce and how do we get those to harmonize and work together. That was what we looked at. And then on Monday it was very focused on how do we reach and teach Generation Z, because Generation Z is coming into the workforce fast and furious here. And, they have a unique set of personalities and needs and so on. And how do we, engage them in ways to help them be successful? And it was really interesting just to see the mix of people who showed up for those sessions. There's definitely an interest in how we approach things from a generational perspective.
What did you think of the overall conference and the vibe? And but what was your feedback on conferences? Because obviously this isn't your first rodeo. You've been to a lot of APHA events.
Yeah, when the first one I went to, I believe, was 2006, maybe back in Atlanta. And it was interesting how the job market was influencing things at the time. You know, people, you would go there because you kind of wanted to be found, right? You were looking for, you know, at the time, the job market was just different. And then that shifted. I can remember when, you know, students were showing up begging and begging and begging for internship, and that maybe that's not the friendliest language, but there were some lean times there for people looking for work. One of my old coworkers made an observation on how and how this year was so much better than last year, because she was talking about how joyful people were to be there. And I thought that was such a wonderful observation. So one of the things that I did is I attended the immunization awards, which I believe was Sunday night. I get my days and nights mixed up, especially with the time zone change. But when you looked at those folks and the impact across all the different areas, they were genuinely happy and proud of the work that they were doing. And my understanding was that, like, that is an example of how things have ratcheted up. So you know, I think there was a lot of positive energy around that. I don't know. I don't know that I had a good perspective to see how well attended or anything like that the conference was. I'm sure I missed some of the high parts getting in late on Saturday. But from what I saw, you know, a lot of positive folks, a lot of folks, you know, just marveling at the possibilities, right? You know, the different possibilities that the conference presents to you, because they have something for you. I think no matter which direction you are involved with or looking to go within the world of pharmacy.
Jesse, I talk a lot about conference and conference strategy to my clients because I want them to get the most out of it. Ural Pharma was our sponsor so that we could go to the APHA 2026 and cover it as press, as well as IPC, Independent Pharmacy Cooperative. And I'm so appreciative of those organizations. Now, there's two organizations that are impacted by APHA differently based on what they do and what their primary business is. Even though they belong there, if you're in pharmacy, you should go to a couple APHAs over the years, especially if you side more in building networking for advocacy, politics, and driving some of the policies that are so important, learning kind of like what's on the cusp, some of the new stuff that might be coming out. But if you are really in pure business, meaning if you are there to build your business or you're there to network in order to find a new career or something like that, there are other conferences that you should be dialed into on purpose to know which conference should I be going to, because you only have so much time. I'm trying to keep it to 8 conferences. Last year we hit 14 conferences, so it was like too many. But I want to be picky about why I'm going and why I'm showing up. The reason why I'm so committed to continuously going to APHA is because they really are the melting pot of the whole entire profession, because I saw everything there. I saw long-term care, specialty, people in technology and AI, and people in education standards and compliance. And I mean, pharmaceutical manufacturers. Like, I love that. Like, that's my favorite part of APHA is the coming together of the entire profession. I think it's badass. And really, that's really the only profession that really kind of does that in a lot of ways. You know, NCPA is all about the independent community pharmacy. And now what was exciting also for me is I only had one day. I usually have 2 days that I cover it in the APHA because it's such a big freaking conference. I didn't have time. I had to split my time between 2 conferences. So I only got 1 day. And that really bothered me. But I got so many interviews. I got more interviews in 1 day than I'd ever gotten any other time before at APHA because it was so well attended. Now, the business side of it, I love the exhibits. Like, if you want to find me at a conference, just go into the exhibits and you'll find me there, because I just have to hang out with that side of pharmacy. That's where I'm most comfortable. And the exhibits were much smaller than what I remember. Like there were only so many vendors. However, when you turned on exhibit time, it was packed. So I'm like, what's better? Is it better to have like too many exhibitors and then it's like a sparse, or would you rather have less, vendors, but it's just packed? Like that's the version of what it was from my perception.
Yeah, that's an interesting observation because I have been to conferences that have been both bigger and smaller, right? But to your point, you can get a flavor of a lot of different disciplines within the world of pharmacy there, and I think you can get something that would allow you to at least begin to expand your horizons. And that's one of those things that stuck out to me. I would say that I don't know that the trade floor seemed to be as big as some that I remember in years gone by.
Right.
But as we already documented, I'm old. So, memory is the first to go, right? But, that, and I didn't even make it into the trade floor until an hour before it closed on Sunday. That's whenever I was able to get in there, and it was more than what I could process in just that limited time, but was able to see a lot of old friends and just some really neat things that are coming down the road, and so very appreciative of everybody who was there and in attendance.
I was proud to see you there. I was proud to see you speaking, and a fellow Western Pennsylvanian on stage. So I'm always ready and always for that. All right. So up on TWIRx News, I want to jump into this with you, Jesse. It's exciting to have you here as a co-host today. First of all, we had some new episodes come out from the Holistic Pharmacy podcast. Marina Boskov is the best of the best. She's inquisitive. She mixes PharmD with holistic. She has great guests. This kind of dives into the athlete lifestyle and what that means and what opportunities that you have. Have you ever picked up one of her shows or listened to any of her?
Actually, Marina and I go back a little ways. She was actually one of my fellow challengers when I did the 31-day American Pharmacist Month Challenge last fall. So yeah, I think the world of Marina. Just top-notch information, and very much appreciate her perspectives and the knowledge that she drops.
I do. I very much appreciate her as well. And there's always a shift to pharmacists that are building businesses, consultants that travel and go into their community and go to nursing homes or go to private residences, and they're kind of like digging into some serious cases, or even in our independent community pharmacies that they're building their holistic side of their business. And there's money in it, and there's opportunities to become a subject matter expert in it, because consumers buy anything. I mean, they're going to buy anything, and they think just because it's a Gunga root or something that it doesn't harm you, but in reality, it very much does.
Yeah, just if I can just give some encouragement to the viewers and listeners here, that your statement there is so true, Todd. People will buy anything, and all you have to do is look at the checkout at your gas station, convenience store, Target, Walmart, whatever it is. There's all sorts of stuff there, and all that stuff began with somebody having an idea.
Exactly.
Right.
And so that gas station crap is like, nobody's there to tell you what's going on with taking.
Exactly. And some of that stuff has very little utility. And, to the audience here, I know the ideas that you have much greater utility and can have much bigger impact in the world. So just encouragement to everybody there. Be encouraged when you stand at the checkout line at the convenience store. You'll find something to inspire you.
We just said gas station, so I got to give a shout out to Dr. Grant Harding, who was the Pharmacy 50 award winner for 2025, most influential because of his TikTok network. He just eclipsed 1 million followers of how much impact he has, basically going to gas stations and literally buying a whole bunch of different things. And then he takes things on, as he's like talking to the camera, and then he comes back hours later and kind of like gives his, I just think he's a risk taker, but his followers love him because he breaks it down from an evidence-based perspective, what some of this stuff is. And and how dangerous it is, but he'll turn around and put his money where his mouth is, which is funny. Hey, up in TWIRx News, it says over in Pharmacy Times, there's an article that just came out titled "The Hidden Impact of Supply Chain Disruption on Patient Care." I've done several series on supply chain and how important it is to have all aspects of the ecosystem of your wholesaler, your buying group, where the ingredients is coming from, DSCSA issues, compliancy, all of this stuff that's part of supply chain. Back in your day, and when you were, in retail, do you remember times where you were just out of stuff forever and the impact that it made on people's lives?
Oh yeah. I don't know that I'll remember any of the specific. Well, one specific product was generic propoxyphene, which is no longer available. But at the time, man, you couldn't get it. Like there were limits on how much can be made in the year and whatnot. And I remember getting into December and not being able to get it. And man, the world was ending for a lot of people. It was ending for a lot of people then. And I can remember just different disruptions with thyroid medication, stuff like that. And it was, yeah, there were some interesting times, to say the least. And also just in the recalls that you would experience from time to time, not just that, sometimes those things go hand in hand. It's not just the supply. Sometimes they have to pull the supply out and do some different things as well.
Look this article up. I'll have it in the show notes. Once again, from Pharmacy Times, The Hidden Impact of Pharmacy Supply Chain Disruption on Patient Care. We go to another article in Pharmacy Times just this week in pharmacy. It's Sports Pharmacy Summit, expanding the pharmacist role in athlete health and performance. And this is led by Dr. Brandon Welsh. I'm so proud of what he has built and how he's shown up over and over again when people would roll their eyes at him when he'd be like, "Hey, I'm going to be a sports pharmacist." And they're like, "What does that even mean?" And now this is a national and international thing, that there are pharmacists now being leveraged for professional football teams and for the United States Olympics and for high schools. But what have you heard on the realm of the athlete in the crossing, the fusion of our pharmacists?
Well, I tell you, this is something that I don't know that I gave a whole lot of consideration to, but in the last, I'm going to say 2 years, I've been seeing more and more information on this. And it's just really interesting, especially as we just went through the Winter Olympics here, whatever it was last month, the month before now, on just being able to navigate through those banned substances and to not take something that could disqualify you from competition at the highest levels, right? And I think there's a lot of things that come into helping people perform and compete at that highest level. I think this is a wonderful thing for pharmacists to be in. Obviously, we have a particular expertise that we bring to the table in the way that we look at and evaluate those situations to be able to help people, perform to the best of their ability whenever they have the opportunity to compete.
Yeah, exactly. Right out of the Hill, just this week in pharmacy, the headline reads, "Washington is getting drug pricing wrong. Here's how states can get it right." And this is by Naomi Lopez with the Hill. And it goes down through, once again, from a writer's perspective, I think she does a really good job giving the kind of like the Wall Streety kind of confusion of what it all means. TWIRx came out. It really didn't do much. PBM reform is in the hottest stage it's ever been in. There's organizations that are setting fire to their contracts and they're seeking out alternative pharmacy benefits that are fiduciary, that give 100% of rebate and things back. And all they do is charge a flat fee. It really simplifies the way it should have been. But where do you think we are with true transparency in drug pricing? And then my follow-up question, Jesse, is how do we communicate that better to the public so that we can demystify it?
Those are two excellent questions, and I'm going to forget them here, Todd. So you're going to have to keep me honest on this. One, I still think we have a ways to go. Any step that we take, I'm suspicious that that's going to uncover a couple of things that perhaps we haven't considered before. So it's like, as you progress down the road, you see there's a couple more different streets that you could turn off to. So I think we still have a ways to go with that. But your second question, how do we demystify that? Part of that is, the open and transparency that we can offer from our vantage points to make people aware of that. But the other part of it is that I think it needs to be repeated. Right. One of my mentors uses the phrase, Jess, people need to be reminded more than they need to be taught. And I think that's one of the big things that I would just share with people in general is that, don't expect that because you told somebody something once about any of this, that they're going to remember it, especially when it's in a state of change. Right, because you need to keep them up to date on those different things that are coming down the pike and can give them some perspective on it.
All right, last up on TWIRx News. This is actually kind of special because I had a super duper minute part of kind of this because of being on the show exhibit floor at the APHA. Shane Jereminski, one of Pharmacy 50's most influential, as well as Maurice Shaw. We did an interview with them together, and Dr. Shaw and Dr. Jerminski did an amazing job. I can't wait for everybody to hear this interview, but I want everybody to hear what Shane had to say this week in pharmacy.
Okay, kids, story time. It's Shane, the accidental pharmacist. Now, I know a lot of you have been asking since my return home from APHA to recount that interaction that happened on opening night between myself and the Director of Pharmacy Operations and Specialty Services at CVS Pharmacy, Lucille Archetta. There are some things I can talk about and some things I can't, but I will try my best to recount that story for you. Now, if you're completely lost, for those of you who don't know, myself and the Pharmacy Guild was at APHA's annual meeting in Los Angeles. We had a tiny little booth in the corner in a sweet spot next to CeraVe. And we had myself, the other co-founders, Dr. Lonnie Duong and Dr. Maurice Shaw from RX Comedy. Bled could not make it. But we also had our team of organizers, both with IAM Healthcare and the Pharmacy Guild, there to help spread the word about unionization of pharmacy professionals across the country. And we paid a lot for our tiny little booth, not as much as the big players in the center with puppies and shit like that. But we had a lot of traction because myself and Maurice were there and all of our friends like Dr. Katie Forbes and the Fit Pharmacist, Walter. So it was a pretty hot spot. And our job there, our primary goal was to educate pharmacists, technicians, and student pharmacists who may not have known that we're organizing stores across the country. Not just stores, but facilities and locations and hospitals, anywhere that's interested in bettering their workplace, making it safer, having better staffing, better pay and benefits. We can do that all with the Pharmacy Guild. Now, for those of you who don't know, we are already in active negotiations in places like Rhode Island, Omnicare in Las Vegas, a store in Arizona, some places in Washington. And one of our largest locations are all the technicians at CVS Specialty in Redlands, California. There's about 120 technicians there that we represent, and we've been at the table bargaining their first contract. For next month, it'll be a year that we've been actually bargaining. We won the election before that, but they make it as slow and difficult as possible. And now that we're getting close, CVS I think that they've given the directive to their labor relations department to just be as slow as possible. I went there last month for 3 days and we hardly got anything accomplished because I think they just want to slow it down and make it difficult. So one of our other goals there was we were going to have a call to action, explaining to everybody what's going on. And then if they supported it, to take their signature, and we were going to submit this to where the person we thought was ultimately in charge, the Chief Pharmacy Officer and Director of Pharmacy Operations and Specialty Services, Lucille Archetta. We did not know, I did not know that she was going to be in attendance. Maurice and I actually had a conversation about this, and I'm like, there's no effing way she's going to be here because she's too far up on the food chain. Now, I guess she was. But the plan was to collect these signatures and then give them all to her. But she decided she would come to us first. I don't know how, we weren't giving out these to anybody. We were having them sign them right there. Somehow, someone got a hold of one of these blank copies and took it over to her. Maybe they came to investigate because we had these little stickers that we were putting on people, like CVS listened to pharmacists and technicians, and it was like these stickers, and lots of people were wearing them. I also had a CVS receipt jacket on, and we were kind of across from them in a way, so maybe somebody said, hey, there's a guy over there wearing a CVS jacket. Anyway, Lucille, I'll play some clips of Lucille. Lucille seems like she's I don't know. I'm just surprised a woman that would approach me the way that she did actually elevated herself to the position that she's in.
CVS says the bill would force it to close the 119 stores it operates in Louisiana, affecting about 1 million patients.
You can imagine 1 million patients across Louisiana.
Why are you petitioning me? And she got like this. She's like, well, why are you petitioning me? And I'm like, I'm sorry, who are you? And then she turns her badge over and she points to the thing and she says, that's me. My name is on the top of there. Why is my name on the top of there? And it really took me off guard because I had to go from like that really open and vulnerable and engaging to, wait a minute, I have to try and put a cogent thought together here and defend the organization that I'm trying to build and what we stand for. And all I could get out was, we have active tables that are bargaining. Your employees voted for a union over a year ago in multiple places, and you are withholding wages and you're not bargaining in good faith. Like, who are we supposed to address it to if labor relations has been given a directive to slow the process down? I thought that's your job as the director of pharmacy operations. And she didn't really know what to say, but she was still super aggressive. She's like, you can't do this, and I'll make sure that we shut it down. And she kind of stormed off. And I'm like, oh my God. Now, at the time, it was only me and Chris Eggman, who's a pharmacist for CVS that's actively bargaining in Rhode Island, who is out there. Is one of the first stores to win their election and is still in this process. And I'm like, I can't believe that happened. And everyone was, we got everybody back there. And before you know it, first someone comes over that's in charge of like the expo, not the highest on the chain of command, but she came over and she said, you can't have anybody walking around. You have to stay right in your area. And I'm like, that's fine. We will make sure that we keep everybody over here. We're not walking around or anything. And so we did that, and that's fine. And then people were still coming over because it's the first night, and word gets around that myself or Maurice is there, and they're still coming over. Then the director of expositions for APHA, John Russell, comes over, and I'll show you the picture of what it looks like because CVS is in the background. You can see me, and he's looking down at me like everyone else does. And basically saying, you can't do this. You can't take signatures. And at this point, now I'm in the mode to like defend this. I'm like, hey, wait a minute. Everyone here is collecting signatures. He's like, no, you have to use the badge and scan it, and you can't do this. And like, you're not going to do this anymore. And this is when the director of IAM Healthcare, who was also present there, who worked with me to help start this organization and reports to a giant union with a lot of resources, said, no, wait a minute. We are allowed to do this. We have paid to be here. We need to speak to someone higher than you. And he was basically like, no, but it was a back and forth. And the first night kind of ended with us like sort of being in, there was some other stuff that happened, but I can't talk about it right now, but it kind of ended like that. Now, Dr. Hogue, the CEO of APHA, came by to get some stuff from CeraVe next to us. And then he was talking to me for a minute or two. And I told him what happened. He's like, I think everything will just be fine. I showed him what was going on. It finishes, and I get a call from him immediately when the expo ends, basically because probably someone from CVS higher up there said, hey, we spend a lot of money to support your organization, shut this down or else. And that's basically all I can talk about at this point. APHA did everything that they could to support pharmacists and technicians and the pharmacy guild while keeping a safe enough distance to still take the money from CVS for the things that they do. But I want to give APHA a shout out because I feel like they really did stand up to just saying, hey, like, we pay the most money, so we make the rules. That's all I'm going to give you guys for right now. I'm going to show you a couple pictures and a few videos of Lucille Archetta and some of the things she's done on television to talk about how CVS is going to pull out of Louisiana, and just some really shitty interviews on television. I mean, I've been on live TV before, and I think I've done better than she has. So if CVS is looking for a new director of pharmacy operations, I'm your guy. When I can fully talk about everything, it's going to be on TWIRx. So if you don't follow the Pharmacy Podcast Network and listen to TWIRx, you need to do just that. Have a great day, guys, and pharmacy on.
That was the best. Like I was blown away by that story. I got to hear it before people hear it today on TWIRx. But listen, this is just basic stuff, or not even an opinion. If you're in pharmacy, Jesse, as big and as prominent that CVS Health is in pharmacy, and you show up at the APHA, it's not your industry. Meaning CVS Health, as much as they think, in my opinion, they think they own pharmacy. They think they can do whatever they want. They get away with whatever they want. I can tell by the personalities of the people that engaged Shane. They're not very PR savvy, by the way. They need PR training. But they really have an attitude that they own the industry. They own the profession. And they're going to do whatever they want. And your techs and your pharmacists are going to have to put up with it.
Yeah. Were you there? Did you witness? Were you at the conference when that happened?
That happened the first night, and
that was before you got there.
I was there the second night.
Okay. Yeah. I didn't catch any wind of that. You know, on the in the hallways or wherever during my time there. So I had seen some comments and whatnot on social media. So yeah, I do find that interesting. I do find that conduct interesting, to say the least.
Yeah, and Shane and we talk a lot, and I trust him. And he says, I want pharmacy to win. I want CVS Health to win, because if they win, that means that we're getting pharmacy services to more people and more communities, and they have the infrastructure, and they're big and powerful. But I don't want them to crush the souls of the pharmacists and technicians and using their PBM to suck out all the profits that they are. So there's some adjusting to do. And that in of itself ties back to how you talk about leadership and what that means. And thank goodness, that the APHA took a leadership position of saying, hey, listen, it's a melting pot of the entire profession. And the profession is not perfect. There's good things about what's happening in pharmacy, and there's absolute shitty things that are happening in pharmacy. And if we honestly work together, we're gonna make it better. But you have to be able to take criticism from inside your family and inside the profession, and then at least react to it in a strategic way instead of the way that she reacted.
Yeah, I can tell you. And this is a fragment of a story that, well, I mean, I'll share it on the podcast, but I'll deny it if anybody ever says this. So amongst friends here, I'll share this. But I can remember a story years ago that my supervisor had. He was actually on stage for a session, and during the Q&A, somebody got up who was representing a union somewhere, and it may have been for the truck drivers. I that doesn't so much matter. But like, sometimes there's appropriate times and appropriate places for some of those things to be had. I appreciate that people are passionate about their organizations and the stance that they have, but especially in healthcare, I just feel the need to call out that our competition is not the pharmacy down the street. Our competition is poor health.
Mm-hmm.
And we like, and the people that come into the pharmacies, that's who they're worried about. They're worried about poor health. If they weren't worried, they probably don't come back in. Right. There's that whole conversation. That's another subject for another time. But, if we take the perspective of how are we tackling poor health, and are we getting the resources to the right place to allow that to happen, I think that's really, part of the conversation that we need to have. And Todd, I'll just throw this out, maybe for a future TWIRx, you and I get together and we talk about the law of compensation. I'm big on leadership laws, and this isn't necessarily a leadership law, but I believe it was Emerson wrote at length about the law of compensation. And I think pharmacists would be well served to understand how that principle works, and the role that we can play within working in a lawful way. And by lawful, I don't mean legal. I mean, as far as natural law goes, to serve the communities in which we operate.
I love that. You are always welcome back on TWIRx. I'd love to dig down into compensation. Let's reach out to some of the associations and get, like, for example, maybe we give Mike Johnston from the NPTA a shout out from the National Pharmacy Technician Association, and then maybe we get somebody from APHA and we do a panel discussion. But I think that'd be an awesome discussion.
Yeah, like this is, this was a subject that I didn't learn about till, I don't know, it was probably 10 or 15 years after I graduated, but it was something that dramatically changed my perspective on just how things should be. There's a lot of things that distort how things should be. And I think if that gives us a bit of a North Star to move towards, it's definitely worth. I would encourage everybody to at least check it out. You can reject the idea whenever it's all said and done, but I would encourage you to at least hear it out to begin with.
Jesse McCullough, thank you so much for
thank you for the invitation, Todd. I went to Los Angeles thinking I'm going to stop by the booth and maybe Todd will throw a microphone my way and I'll just start interviewing people. I'll be the man on the street running around. But we were ships passing in the night. We missed. So I apologize for that, but I'm so glad we were able to reconnect here.
I know. I appreciate you. Yeah, we have an upcoming interview with Johnny Kello and Ria Chow from LSPDS. So you're not going to want to miss this. We have a quick advertisement and we'll be right back with more TWIRx.
Running a pharmacy means juggling a lot. Patient care, inventory, and now compliance. That's where MatchRx comes in. MatchRx is an online marketplace where independent pharmacies buy and sell their overstock safely, quickly, and affordably. You can also shop from 11 plus trusted secondary wholesalers all in one place. We're here to make pharmacy ownership easier, connecting you to savings, trusted partners, and simple tools that help you stay compliant with confidence. MatchRx, where pharmacy meets trust, compliance, and opportunity. Visit MatchRx.com to learn more. That's MatchRx.com.
Hey, welcome back to This Week in Pharmacy. This has been a tiring week for me, as I've told you in the news segment, getting back from the American Pharmacists Association 2026, and then also headed on. I went from Los Angeles to the Profit Summit in Dallas. And what I'm excited about being back in the studio is to start gathering preparation for compounding expansion, as well as the subject around specialty pharmacy. And there's something that keeps sticking out in every segment of pharmacy that I've talked to hospital system administrators and VPs of pharmacy, compounding, obviously, in our community, independents, the compliance aspect of your business. It's something that you do not want to have to worry about. It should just, in my opinion, you should have a team behind you and just kind of set it in place and concentrate on building your business. But as a pharmacy owner, you do have to be tied into what's best. Johnny Kello is back in the studio, and Johnny Kello and the MatchRx team brought us our first dig down deep into what the heck the updates on DSCSA. And you're back, Johnny. It's so good to see you.
Hey, thanks. Thanks for having me back. And I'm excited because this kind of ties back, like you said, to our original series with Elisa Bernstein, who headed the launch of the DSCSA for the FDA. And now bringing it full circle, I want to introduce Ria Chow. Ria is the founder, CEO of LSpedia. And they're a remarkable company because all the issues that we think about and worry about in the space for the independents, I think they've got a good grip on, and they've made it easy for the independents to be able to solve this whole track and trace, or EPSIS, whatever they're calling it this day, but it's a matter of compliance. And I think they've done a heck of a job of helping these independents get there.
Ria, welcome to TWIRx. Your team is just as tired as I am this week because they made the trek out to Los Angeles. I actually got to have them on my post show. So the post show for APHA 2026 will feature a segment on LSpedia. So it's so good to see you.
Thank you, Johnny. Thank you, Todd. Thank you for welcoming here. And I'm really excited to be here. At LSpedia, our mission is quite simple. It's to make pharmaceutical supply chain safer, easier, and more effective. So we spend years, really years, helping manufacturers and wholesalers to comply with DSCSA. And now we are bringing the same robust solution and the computing power to the pharmacies. And because pharmacies are the last mile to the patients, and we want to make this DSCSA implementation easy, smooth, effortless, and built into their workflow. And how easy? If you can take a picture with your phone, you would know how to use our solution, which is called OneScan Pharmacy Pro.
Johnny, how do you see this tying into the technology that MatchRx has invested in quite some time, long time? I think you and I, when I first remember MatchRx coming to market, is that 15 years ago?
Yeah, 16 actually. It's 2010. And this really, again, I hate to be redundant, but this really does bring us full circle because we started at the DQSA level when this was just ideas about track and trace, which is what they called it back in the day. We visited DC on many fronts on behalf of independent pharmacies, and collectively we helped formulate some of the ideas behind the solutions here. But we're not that smart, so we needed LSpedia to actually put it together. Ideas are ideas, but actually execution is a lot bigger. But I want to address something with Ria, because for independent pharmacies, like the word DSCSA, we've heard about it for a long time, literally since 2012. The can has been kicked down the road, but now it's real, and now it can feel overwhelming. And there's a lot of technology, a lot of terminology, but tell us about the actual needs and why there's uncertainty and why LSpedia was able to solve for it.
Great question, Johnny. Yes, so DSCSA has been a regulatory requirement for a long, long time. And this requirement was designed to be phased-in approach, initially with manufacturers, then wholesale distributors, then large healthcare systems and large dispensers. Now it's coming down to the last deadline, which is the small independent dispensers. Well, it is already happening. Serialization is already happening. Products are coming into pharmacies with 2D barcodes. So those 2D barcodes looks like QR code, but they embed a lot of product data, including the NDC, expiration date, lot number, and the serial number. So the expectation from the FDA and from the entire industry is really for the pharmacies to be able to trace who they bought it from, what products are they, can they be verified, authenticated if there's an issue, such as counterfeit, suspect products, or illegitimate products, can the pharmacy validate it? And if there's an issue, report it through a reporting tool called 3911 to the FDA. And the gap I'm really seeing in many pharmacies is still that they don't really know that they need to do this. There's a lot of misconceptions. I think Johnny and I will definitely talk about this more. There's quite a bit of pharmacies that's still in the dark, which this podcast will help address.
That's right. Well, thanks. And you're right. You're spot on. When something, they promise, that it's going to happen, and then they move it another year, and then they promise that they move it 2 more years. And then finally, on November 27th, 2026, it's actually going to be trickling down to the independents and independents with under 25 full-time employees. If you're an independent and you have 25 or more, you're under the obligation to follow the guidelines of the DSCSA and all the requirements for reporting your products that are coming into your system. So tell us a little bit about why the hesitancy, because as we know, time sneaks up on us. So November is right around the corner, and what's the hesitancy? Is it lack of understanding, or is it just that they want to wait to the last minute because they don't want to pay for a service they may or may not need?
You brought up really important points. Is why are the small pharmacies not taking actions? And it's interesting, actually not taking action, doing nothing is doing something, right? So that's one thing I want to point out. And two things is just demyth some of the misunderstandings out there. Some pharmacies think that they are under exemption, but the exemption is expiring, right? So small pharmacies are under exemption. The exemption is not really a strategy for the pharmacy to rely on. The exemption is simply a legal leeway to say, okay, FDA is not going to come in and then penalize pharmacies because large amount of pharmacies still need time. That's precisely why there's a exemption, why there was exemption for the small pharmacies is because FDA really understood that dispensers, especially smaller dispensers, need time. And so that's myth number 2 is pharmacies think that they can get on the bandwagon November 26th, switch it on. Right. So that's a misconception because this is really, DSCSA is really deep. You think about it, pharmacy going from paper and pencil to absolutely everything digital, right? That's a huge transformation. And this transformation doesn't come with the flip of a button. You think about pharmacy buy from their primary wholesalers and several other secondary wholesalers. So all these wholesalers or distributors need to be switched on. So it's not one button, right? Let's say there are many, many buttons, and each button is not a click, right? Each button is various communications, data exchange until the data start to flow. So I would say waiting creates operational risks. What if you ran out of time and your wholesalers have not switched data on? Now you are stuck. Your toes are sitting there and you can't receive it in because under the law, every single product coming into your pharmacy needs to have the digital EPCIS data to support it. So we've seen pharmacies in the past that have been hey, I'm small, I'm just going to do nothing. But a lot of pharmacy got hurt during the opioid epidemic because they didn't do anything, right? Because they didn't track, because they didn't manage the control of products. So we don't want this to happen for Drug Supply Chain Security Act. We want pharmacies to be proactive. So if a pharmacy can verify a product, if they don't know if it's suspect or illegitimate, if they don't have visibility and they do nothing, and that will create a non-compliance exposure. And it's not just about inspections, right? It's really about day-to-day operations. What happens when something goes wrong? The pharmacists that are DSCSA ready will move much faster, right? They will be able to receive a toll in a minute. And that's what we've seen. Pharmacies that adopted our Pharmacy Pro solution, they save 90 minutes a day, every day. And that's a huge add-on for pharmacies who are overworked, right? They can use the 90 minutes actually helping patients, actually doing what they love to do, is to take care of patients.
Yeah. Yeah. And not to say of the fact that it's not one person that needs to learn this process. It's the entire team for each pharmacy. So as your point is, flipping the switch isn't good enough. It's a lead time. It's having standard operating procedures, which LSPDA provides as part of the Pharmacy Pro piece of the equation. And so it's not a one-trick pony, what you guys are offering. It's several pieces of the puzzle that really put the pharmacy in compliance. And to your point, having this onboarded now so that you can train, so you can onboard the wholesalers that you're buying from or anywhere else that you're buying from, including MatchRx, it makes life a lot easier for everybody. But talk to us about a little bit about the risk, though. What happens if the pharmacy isn't ready? I know you touched on it a little bit, but what are the repercussions and where does that hit the most? Is it like a state board audit? Is it a PBM audit? Talk to us a little bit about that.
Absolutely. So the states have incorporated the DSCSA requirement into their inspections, right? The states that I've been in communication with, including the state of Michigan, state of North Dakota, state of Florida, state of, you name it, right? We have 50 states. Every single state has incorporated DSCSA into their inspections. And NAPP has incorporated the inspections into their accreditation programs. So obviously, FDA. So FDA's approach about inspections is if there is an issue, right? They are definitely issue driven. If there's an issue, they'll definitely look into it. They also have routine inspections. I think for pharmacies and wholesalers, like FDA is a new concept. But if you look at the manufacturers, they've been under the FDA jurisdiction for a very long time. And they know, like, this is no joke. Like, when FDA shows up and they see things that's non-compliant, they call observations. When they have those observations, it's serious business, right? So for those pharmacies that have gone through state inspections, they probably already know that the state asked this question: can you show me the trace records? Can you show me the product verification records? Right? These are very much anticipated from all levels of inspectors. So the risks are on the state level, fine level, but on the federal level, it's really about the continuity of your business.
Good. And so a lot of these pharmacies assume compliance only matters during inspections, but it's more than that, right? It's operationally. And so again, I know you touched on that just a little bit. It's not just when an inspector comes through or an audit comes through. Just from an operational standpoint, talk about receiving product and being able to track it.
Yeah, it is operational. So it's every day, right? For every tote that comes into your pharmacy back door, all those products have a specific serial number and a record tracking it. This is a great way to utilize this moment to digitalize your pharmacy. So I would just say most of the pharmacy owners really don't know what's on their shelf, right? Why don't they know? Because everything's paper and pencil, right? They may know anecdotally, but not to the details that this track and trace program is requiring. So the risks are if you don't have a system, right? And you think, oh, why don't I just track it with an Excel spreadsheet? That would be hours and hours and hours of work. And you can do this in 1 day? Can you do this in 365 days, right? Having a system make it so easy. So we have a video on the YouTube. Feel free to watch it. So we have a pharmacist from a long-term care pharmacies, so huge operations, 24/7, and there's a huge amount of receipts, and they show us how they do it. And it's so easy, right? He gets a tote, he can scan the tote. There's a tote label. He scans it, voila, it's in. Or he picks one product from the tote, he scans that one product, and the Pharmacy Pro system finds all other product in the tote. So this technology is really amazing. It has this parent-child relationship, so it always knows whether a product belongs to a purchase order or tote belongs to a purchase order, or how many totes and products does a purchase order have. So it ties everything together, makes this intaking process super easy for the pharmacies. And then from there on, there are lots of different places serial numbers are needed. As of today, traceability for sure, product verification for sure. But in the future, Optum RX is talking about that they want the serial number for medical reimbursement, right? So you think about what this serial number can be functional in other areas. This is why we need to get started. So all your inventory has serial number. So in the future, if you want to return something, a serial number is required. If there's a recall, a serial number is required, right? When you send claims, serial number is required.
Yeah.
So this is going to be tied into every fabric of a pharmacy operation every single day.
So talk to us about when somebody says, "Oh well, do I really need a solution like LSPDR? Could my pharmacy software provider provide it for me, or could my wholesaler provide it for me?" Tell us a little bit about, yes, is that possible? But is the extra work that needs to be done, or you really do need a solution provider?
Great question. We get this question a lot, right? So we have customers who said, hey, we buy from one primary wholesaler. Our primary wholesaler is telling us that we can go to their portal. This is great. You can go to their portal, but you also buy from other distributors, right? How many portals can you go to? If you have to receive a tote going to a portal, receive a box going to another portal, receive 20 other boxes going to 20 different portals, that's a whole day. So it really comes down to how much time do you want to use in this compliance, right? So having a solution that you pay, I would say $3 a day, that can save you 90 minutes a day, definitely is worth the time. Also, people also say, you know what, my PMS can do this. But the reality is PMS doesn't, right? That's why we integrate with PMS, because PMS loves us. PMS love to have LSPDR Pharmacy Pro to be the front of DSCSA compliance, as well as being the receiving operation, where we can just push inventory received into PMS and making this entire inbound process seamless.
Yeah, great. So, all right. So we've heard about OneScan and Pharmacy Pro and all this cool things that you guys put together. What exactly is it? Talk to us about what are the key points and how are people using it? I know you've touched on when the tote comes in, but how does it integrate with their software? Why is it so easy? And then why do I absolutely have to get it before November 27th so that I'm ready for November 27th?
Happy to. Pharmacy Pro is a solution that we designed specifically for dispensers. OneScan is a bigger suite. OneScan is what we cater to manufacturers and wholesalers. Manufacturers and wholesalers have very complex operations, both inbound and outbound, and also their connections with CMOs. And it's just different, like a different operation, right? For pharmacies, we know pharmacies don't have a team of IT, right? They don't have a team of serialization expert. So, but what we really understand is pharmacies want to have a streamlined workflow. They want their they want their time to be in the front room, not in the back room. So we created Pharmacy Pro in 2023, and just really leveraging a very large engine, which is called the OneScan, right? We're leveraging all the functionalities that can operate very large companies as well as very small companies, and we made a workflow specifically for dispensers. So this is purpose built, right? This is not like an afterthought.
Yeah, reverse engineered.
Right. This is purpose built for pharmacies. And it's a browser-based solution, and it's also responsive. So you can run this on your computer. You can also just run this on your phone, on your iPad. It's device agnostic. And we really leveraged the ability for the device to turn the camera on, right? Or have connect wirelessly, Bluetooth with a scanner. So either way, it's about how does the software interact with the product? And for us, interaction is super easy. Turn on the camera or use the scanner to scan that 2D barcode. That is the number one interaction. The pharmacy and the products are happening in our solution. So when a pharmacy tech pharmacist, when staff scans the 2D barcode, right, we, from that parent-child relationship, we know precisely what this product is from, its purchase order, its tote. So then we tie them all together, right? From a product, we can find a tote. From a tote, we can see all the products. So vice versa, making this really seamless. And toward the end is a full set of digital records. I know for smaller pharmacies, this sounds complex, but you think about very large pharmacies, such as Amazon and health systems out there. These digital records, they live and die for, right? They do all their planning according to these digital records, including the projected receiving time, their reorder time, their restock time, the quantity for restocking, what is the 30-day purchase projection. So there's a lot of things that you can do with it. And this is precisely why we love Pharmacy Pro and our customers, because we really want to help our customers. If you're not really using technology, this is step number one for you to get there. Get Pharmacy Pro, then you can start using technology, and we'll help you.
Well, yeah. So on that note, we've been a little bit ahead of the game ourselves. We've probably given away, I would say, a couple thousand 2D scanners from TWIRx for free to our members, knowing the VRS system is going to be coming into play. Posting a product on our site is going to require ultimately a scan so that the serialization number is specifically tied to that product, and it can be verified against the system. So what we've done, just for the audience sake, is that we've created a partnership with LSpedia to really help our members and help LSpedia. One is that we're a reseller for LSpedia, and we're proud of that because we know we got 7,000 independents, and that's a new frontier for LSpedia. And I think that we can really help our members really get adoption into something that's going to be a needed tool. So we're excited to be partners with you guys on that front. That's what makes this partnership so easy for us and you guys, is I think we're serving the same master, which is the independent pharmacies, and try to help them ease their way through this kind of convoluted, but not too convoluted, but what seems to be a confusing process. I think we're excited mostly by being able to actually be able to do that for them. So really quick, I think we've got a great framework of what Pharmacy Pro is, what LSpedia is being able to do with the independents. Just a few quick rapid fire questions. All right. So this is for you. All right. So what's the single biggest DSCSA misconception among pharmacies today?
Is that DSCSA is still coming. It's not coming. It's already here. So I want to demyth that.
All right. So what's the one thing that pharmacies should start doing immediately if they haven't already adopted some solution?
They should go to lspedia.com/pharmacypro to sign up.
All right.
Or sign up through MatchRx, a trusted brand nationwide.
Oh, thank you. And we get it. We've been lucky enough where LSpedia has been providing our MatchRx members a discount for their service, and so we're excited about offering that. So how complicated is DSA compliance really when the right tools are in place?
Without the right tools, very complex and impossible. With the right tool, very simple, easy. One scan does many things for you.
Okay. And then you mentioned 3911. So what happens if something gets scanned and it's not right? What's that? What are they supposed to do? Do you have a process, an SOP that you hand over to the pharmacy so that they can track? Because not everybody's going to be able to create their own SOP. I mean, like I'm not an expert in SOPs, and I don't think independents are, but I'm assuming that you guys have already, created something that pharmacies can help fill in the blank, so to speak, for their own benefit, so that they have a process that they can share with any auditor that comes to their store.
Precisely. We have SOP templates that it's right in the software itself. So which is really great. You don't have to go somewhere else to look for paper or look for a file. It's built right into the software, and pharmacies can adopt those templates into their own, adding their own operational specialties. So this makes everything all together: scanning, SOP, reporting, right? It's all in one.
That's awesome. Look, we've covered a ton. I can ask another 10 more questions, but I'll leave you alone right now. So, the takeaway here is simple. It's the DSCSA isn't something that pharmacies can just put off much longer. It's here, like you just mentioned, but the cool thing is that LSPD is here as well. MatchRx is here as well. And collectively, I think we're happy to help. If nothing else, just to guide. And whether it's an LSPD solution or another solution, get a solution is my advice.
I completely agree.
Any closing thoughts, Rhea, that you want to share with the team or with the audience? And Todd, you've been a lot of help doing nothing here today.
I like to step away and you got to take over the show. I like that.
Well, what I can say is MatchRx is really a trusted brand for independent pharmacies, and we are very excited. As you know, Pharmacy Pro is a trusted brand as well. When you put two great brands together, we can do great things. And I love how MatchRx and Johnny, they want to solve a problem, right? They are not just putting lipsticks on pigs. They really want to solve a problem for their customers, and so do we. So let's do this together.
Awesome. Well, thank you very much, Rhea.
I love it. I appreciate you, Johnny, bringing us always good information. Appreciate you, Rhea. I promise this won't be the last time you're back on TWIRx.
Love to come back. Thank you.
Hey, we will be right back.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
Hey, on this week in pharmacy, we're welcoming Scott Brunner, CEO of the APC. Scott, it's good to see you.
It's good to be here. Thank you.
Hey, you had a special event. You had a conference that was dedicated to pharmacy owners and the fusion of everything that's happening in technology and AI and operations and growing your compounding business. And when I heard about this, I was very upset that I wasn't able to go with some other commitments and other conferences. But I want to give you the mic and have you share with our listeners, how did the Owner Summit 2026, how did it go?
It was extraordinary. We began this event 6 years ago, recognizing that while there were an awful lot of events and continuing education courses for compounders on the clinical side of compounding, the practice of compounding, there was not much out there on the business of compounding. And so we created an event exclusively for compounding pharmacy owners and managers, and it's just grown every year since. We were frankly blown away by our numbers this year. We had nearly 400 folks there, and that's attendees plus exhibitors. We sold out the trade show portion of the event, 60 exhibitors there, and we had industry leaders from across compounding to talk about all those things you said. Particularly front of mind is the regulatory environment, some state legislative threats that we are confronting, but also issues like appropriate marketing. How do you market your compounding pharmacy? How do you create a brand? How do you provide exceptional customer service for pharmacies that are interested in doing fulfillment, for instance, for telehealth platforms? We had a session about that. We had a session about positioning your pharmacy for sale. And there were some of our attendees who were interested in that. So it was just it's a cram-packed day and a half, literally about 27, 28 different sessions within that day and a half. And they're just all over the map related to the business of compounding, compliance, and the regulatory framework.
Scott, if I'm listening, I'm a pharmacy operator owner, and I missed out on this owner summit. What key takeaways can you kind of shout out that you say, hey, here's how to get engaged. Here's what you should be thinking about in growing your compounding business, and maybe even throw in a legislative support request so that we can make sure that the momentum that the APC has helped to get going, that it keeps going.
Yeah, well, one of the key takeaways from the conference is that operating in compliance with federal and state law and USP standards is your best defense. Yeah. It's your best marketing strategy. And so we talked about some of the excesses in the compounding marketplace right now, to the extent that we basically said, pharmacies that are preparing compounded drugs with unauthorized ingredients, including, just to put a point on it, certain peptides that aren't authorized for compounding, are not helping the reputation of the industry. A lack of attention to insanitary conditions is not helping the industry. And frankly, being divided, big pharmacies versus small pharmacies, traditional compounding pharmacies versus telehealth platforms, pointing fingers at one another is just not helpful right now. I think the threats that compounding is facing affect all compounders, regardless of your market focus or your structure. These legislative threats that I've mentioned are very real, and they will affect all of compounding. And so we have to stand together. If you have listeners who are not members of APC and are doing any amount of compounding at all, I strongly urge them to look at joining us. We are stronger together. And frankly, I think they're going to be better informed. Their teams are going to be smarter about compliance and trends and all of those things. And we may be able to save them from a lawsuit or an unpleasant interaction with the Board of Pharmacy.
I want to shout out two things about APC. Number one, you have an amazing podcast. You do a great job. We're very proud that you're members of the Pharmacy Podcast Network. The latest podcast dug into the world of compounding and artificial intelligence with TGAM Labs, Jonathan Adley. His team has been popular among different sectors of pharmacy. And then the second thing, to follow up what you just said, Scott, is the Compounders on Capitol Hill, which APC is a huge part of, is going to be taking place this September. So if you didn't get a chance to go to the Owner Summit, but you really want to support the evolution of some of the legislation that is, always on the block, and it can be cut off or it can keep going. And if we get more and more people involved in coming together and reaching out to legislators and being very positive and being very educational and sticking to the facts, I think this is a big opportunity, Scott.
Yeah, and this is our event as well. So Owner Summit and Compounders on Capitol Hill are our premier conferences. Compounders on Capitol Hill is another day and a half, a little more than a day and a half in DC. We will have our third annual legal symposium, Legal Issues in Compounding, with a number of prominent attorneys in the space. We will spend some time prepping attendees so that they're conversant on issues that are threats to compounding, and then we will send them to Capitol Hill. We will schedule for you your meeting with your members of Congress so that you can share with them concerns about issues confronting your business, and not just your business, but more importantly, your patients. I expect with the magnifying lens that is on compounding right now, there is no better time to come to DC and make your case to your members of Congress, because they're hearing from drug makers and drug maker lobbyists. They are seeing misrepresentations in media and elsewhere. And we believe compounding pharmacies from their districts, constituents, are the right people to set them straight, to tell them what law and policy actually says, how compliance is done in compounding pharmacies, so that we're not facing legislation that unduly infringes on patients' ability to access compounded drugs when their prescriber says that's the right drug for that patient.
That's terrific. Okay, so listeners, by the way, go to a4pc.org. Once again, that's A4, the number 4pc.org. The Alliance for Pharmacy Compounding. Scott, I really appreciate you stopping by on This Week in Pharmacy. It's so important to keep our operators and our owners fused with good information, evolving and encouraging, because we know communities, and we know with the sparseness of some of our areas throughout the United States, without pharmacy services nearby, that once again that pushes compounding further down from being accessible by patients. And we need educated compounders and compounders who know how to market this stuff correctly, and getting the education out to their community, but then of course our legislators. So thank you so much for this time.
Thanks for having me. It's good to see you.
It's good to see you. Hey, we'll be right back with more on TWIRx.